options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Avazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, welcome to another episode of the Egg Whisperer Show. Tonight I'd like you to meet my special guest. This is Judy Tognetti.
Hi, nice to meet you all.
She's from Nurture Acupuncture. She's one of my most favorite acupuncturists. I've been working with her for almost 10 years now. So Judy, tell us a little bit about yourself.
So I've been doing acupuncture about 16 years now, mostly in the fertility arena. I started out training as a OBGYN and then decided to leave medical school for some personal reasons.
No, shut the door. I did not know that.
I did. I left and my mother was not very happy
she's
either.
So smart.
And it took me a couple years and then I got introduced to acupuncture.
Mm-hmm. I'd be kind of mad if I was your mom too. Anyway,
Yeah, she was.
That's okay.
I almost got disowned.
Yeah.
But anyway, I went on to find acupuncture and decided that I could take it into the gynecology area. True. And did some fertility work with it and found it to be really effective, and I still got the benefit of what I was wanting to do educationally, and I love it. I wouldn't change anything in the world for it.
Okay, well I have you here because I want you to needle me.
Okay.
Will you needle me?
I will.
Let's do it. So show me, how do these needles work? And
So
I'm
these
just gonna let
are
you do your thing.
always sealed, so we have sealed needles, and inside we particularly use something called a guide tube so that it's cleaner, so that our skin and our bodies never touch at the insertion site. So the needle is threaded through this little tube into there like so. And then what happens, we normally will clean the skin with some alcohol, obviously.
Okay.
We're going to push the guide tube down onto the skin, and when we push it down, usually you feel no pain or anything. So we
Right.
just insert like this.
I felt nothing.
And then the needle sits there. It doesn't usually go any further than through the main level of the derma. It can go a little bit deeper.
Got it. So I'm feeling really positive right now. Just kidding. I feel blood flow to my uterus, my ovaries, better eggs.
It's true. Better eggs. Exactly. And then normally they're retained about 25 to 30 minutes. And
I mean, I actually do feel something.
you can. It's on the lymphatic system right there. So you
Really?
might.
I actually feel like a dull sensation in my
Going
hand.
through there. So then obviously we dispose of them.
Okay.
These are now just for Amy's purpose.
Got
So
it.
these would go into a hazmat container
Got it.
and we would not
reuse them.
autoclave them. Yes.
Okay. So how exactly does that work when it comes to fertility? How does fertility acupuncture work? You have to tell us.
So fertility acupuncture is based on the concept of using the nervous system, the lymphatic system, and balancing hormones. So by utilizing certain points in the body, we're able to adjust the hormones. If we use electrical stimulation, we're able to secrete neurotransmitters. So at certain amplitudes, we can secrete serotonin, dopamine, whatever it is that we're trying to secrete. Other than that, we're using needle points that are selected over the ovaries or over the uterus to drive blood flow, increase lymphatic circulation, balance the hormones.
Okay. All good
Basically, in a
stuff.
nutshell, that's what it's doing while we're doing
And
it.
what happens when you go to a fertility acupuncturist like yourself for the very first time? What can someone expect at the first appointment?
At the first appointment, you should really be interviewing your acupuncturist to make sure that they actually know what they're talking about. There are a lot of people doing acupuncture for fertility that may or may not understand exactly how to do it. For example, if you're down-regulating their cycle, meaning with Lupron or birth control pill, then we should also be down-regulating with the needle.
Yeah.
And I have seen variations of downregulation not occurring, and then that can cause problems when you go back to rescan. Now they have cysts or formations of fibroids or anything that could be formating as we don't want to have happen in the downregulation. So definitely interview them, make sure they know what medications are, how the medications are used, what to do with the needle.
And they
during
can
your
communicate
cycle.
with the fertility doctor, because you and I email all the time. I
That's
send you
correct.
calendars. I say, hey, this
You
is the
can.
patient's calendar. Make me look good. Work your magic.
That's right. So definitely interview them, pick the right person, or get a referral from your MD like Dr. Amy.
Yeah.
And that way you'll know that you're in the right place and you're not wasting your time and money and efforts. More of it you can, more of it's about your efforts than it is about any of the other things. We can make more time and we can make more money. So.
And then how many sessions does a patient on average need? So I'm going in, I'm seeing if I'm ready to do IVF, I'm seeing you. What do I do? How many
So
visits?
normally for IVF, thorough history should be done. If you've had a lot of complications and you're, age 45, then obviously you're going to need a few more treatments than somebody who's 22 that is undiagnosed infertility. So normally we say to people, come about 3 months before. Let's evaluate whether we need to start ASAP, or we can come and have you start another month from now or 2 months from now. And that way we can evaluate what we need, how we need to do it, and if we need to institute any kind of supplementation or any kind of herbs, etc., into the protocol for you.
And the other acupuncturists at your center, because it's not just you, there are several wonderful acupuncturists there. What if someone, let's say, sees you one session, then sees someone another session? Is that detrimental at all for their care, their progress?
Not so much. In our business, the three main doctors have been practicing. I'm the most junior at 16 years. The other person is 30 years and another one at 25 years. So we're a very senior team. Anyone that has worked with us or is working there as an associate has been trained by us for several years. So there should be no variation in the protocol that's being instituted. It just may be a personality thing. Maybe you want to talk to a female versus a male, or you like to come on Friday. You know, so we have that open so that you can come 6 days a week, so that it's easy for your travel during the week or the weekends, whatever you prefer. So you can definitely see any of us. We're very interchangeable.
So I hope you're not going to be insulted if I called the herbs you give patients fancy dirt.
No, it is fancy dirt. It smells like dirt, looks like dirt.
Tastes like dirt.
Tastes like dirt. It's medicine, and people think it's a tea. It's no Lipton tea. It's medicine.
Okay.
And it's composed of bark, seeds, flowers, etc. So there's roots in there, so it does smell and look like dirt. We use a freeze-dried granulation, and that is easier to take than somebody that has to cook.
So tell me about dirt. I mean, don't be insulted, but when I tell patients about Chinese herbs, I'm just thinking about, oh my goodness, they're going to be eating dirt. What's the deal?
The deal is it's granulated herbs, and they do look like dirt. It actually looks like sand. It can be shaken like sand. It's composed of roots, barks, flowers, seeds, nuts, a bunch of different things. It is freeze-dried, and then it's granulated, and then you take it by the teaspoonful. And when you do that, you put it in some warm water, shake it up, and then shoot it down. Don't take time and make a big glass of tea.
Can you mix it with vodka?
You can mix it with vodka when you're not trying to get pregnant. It would taste much better with vodka. That would be correct, but no.
And do you give everyone the same formulation of Chinese herbs, or do you just change the prescription, or depending on what they're going through?
Yeah, the prescription's based on your medical history. It's also based on our analysis of what we find by palpating the abdomen to see what areas in Chinese medicine.
You have to tell me about the whole palpation thing. We're going to get to that.
Okay, we'll come back to that.
Yeah.
We palpate the abdomen to decide what channels in Chinese medicine or what organ pathways are not correct, and then we use herbs to adjust for that. We also look at the tongue and the pulse and then decide what we need to do based on the medical history.
Okay, and then how long is the patient typically on Chinese herbs for?
Chinese herbs are done, some clinics allow Chinese herbs to be taken all the way through the retrieval, and some have it shut down as soon as the gonadotropins or the stimulation medications begin.
And what do you think is best? I mean, based on your 16 years of experience, I'm sure you have an opinion.
Based on my experience, they do best if they continue through the retrieval. But if I've had you for 3-4 months already on the same herbs, then I don't really care about 10 days.
Got it.
By then, my job has been done anyway. But we do see some improvement with the size of the follicle and the tracking of the follicles being about the same size with the herbs in general.
So one of the things that I'm concerned about is if someone starts something new, all of a sudden, like right around their transfer day, and then they might develop an allergic reaction. So I don't mind if patients are on the Chinese herbs. I actually prefer if they start before treatment to see if they'll develop an allergy. Because like all things, medicines, people are allergic to some things and you wouldn't know until you tried them.
That's right. I wouldn't even give them to you if it was the first time I saw you and you were doing transfer. The only way I would
give
look
them
at
to me.
that.
I'd ask you and be like, Judy,
yeah, then I
you
might.
have to give it
if
to
you
me.
push me. There are some different herbs though that the ones that are used for post the IVF transfer have very low allergens in them. There'd be they'd be less likely to have an allergy or allergic reaction to them versus the ones that are made to go in the follicular phase of a stimulation.
Okay.
Or even
so
the
you're
luteal
saying
phase.
a lot of fun words like stimulation.
So the stimulation would be what Amy is having you do with the medications that you're injecting, or if you're doing an oral Clomid, for instance, then these medications, the herbs could technically indicate with them, and you may get some response with them.
Okay, so you're saying herbs can't hurt if you don't have a bad reaction to them.
That's correct. Herbs cannot hurt, and usually we have you start slower than average and then work up to the full dose so that we can monitor any kind of symptoms.
So you brought up something post-transfer, and one of the things everyone asks me about is the darn pineapple core. And my joke is that soak the core in some nice rum.
Yes, make a little
and then the
daiquiri.
next morning you can suck on it. But core to me is really bitter. I mean, that doesn't sound like fun. You just had a transfer, you want to be relaxed, you want to eat things that you're used to eating, and now you're going to eat the core of a pineapple. What's that all about?
So I tell people just take the core, divide it into 2 or 3 doses, depending on what day of the
Pineapples are
transfer.
really hard. How are you supposed to cut a pineapple? You know, you might cut yourself.
You just buy it cut up at Whole Foods. And then you take the core and you divide it, and I personally just chew it and then spit out the core itself. It's very fibrous. There are people that enjoy eating the core, and I say go for it.
Chew it and suck on it.
Chew it, suck on it, get the juice
And
out
then
of it,
spit
and
it
then
out.
spit it out. And that will give you the bromelain, which is what we're looking for to
So it's suck and spit, don't chew and swallow.
correct.
Hashtag suck and spit, don't chew and swallow.
Yeah, if you want to swallow
I
it,
see
you
a picture of a
can.
pineapple with that hashtag.
But we're looking
everyone
for that
to see.
bromelain to inhibit any kind of inflammation that could occur.
Okay, and so inflammation is bad, obviously, because when an embryo is going to get all snuggly inside the uterus, you want it to just continue to stick and grow.
Correct.
Not be attacked by inflammatory cells. So you want it
Right.
a nice anti-inflammatory type of environment.
Correct.
Okay, so there are all sorts of other recommendations that acupuncturists make, and I'm just like, seriously? Okay, one of them is you can't eat or drink anything that's cold. Everything has to be warm. I mean, in the summertime, that's like really, really hard. Why do you do that to my patients?
Well, it's not my rules. So Chinese medicine believes that things that are raw or cold take longer to digest in the body and therefore can influence the way hormones are producing.
Okay.
For instance, if you eat something really cold like ice cream, your body then has to heat itself up to digest it. By doing so, it can impact the thyroid possibly or change the way the hormones are. The other thing with ice cream, even though it tastes really great, is it's very sugary, not so awesome for fertility in general. And when you do that, it's junk food, empty calories, etc. It will shoot your cortisol and your insulin, and then that will change the way your hormones are also
That
producing.
sounds like no fun. I don't want ice cream anymore now.
Well, when you're done having babies, you can have all the ice cream you want.
And then what about like alcohol, coffee? I mean, I tell my patients alcohol in moderation is okay. You know, most Americans, when you look at a wine glass, they're basically pouring an entire bottle or half a bottle into
Right,
a glass.
yeah,
And I'm
so-
telling them 4 ounces, and 4 ounces is half a cup.
4 ounces, most of Americans don't know what that is, so
No,
4
that's true.
ounces would not occur.
So you say basically no. No
We say alcohol is okay in moderation. Now,
Okay.
during the stimulation, if you've had issues, you may not want to do that because it may affect the way that your follicles are producing.
Okay.
But if you're doing IUI or trying naturally or any of these other methods, then red wine in particular is better than any form of white wine can be, because white wine will turn into sugar very quickly, where
Right.
red wine has some antioxidant properties technically.
If you have 4
So,
liters of it,
If you have 4 liters of it,
you might
it
get
may
that
be different. You
resveratrol
might
to
get
help
pregnant
with your
easily.
egg quality. That's
Yeah.
right. And then what about coffee and your recommendations on that? Because anytime I have patients and I'm like, you can drink 1 cup of coffee a day, Judy told me I can't. I was like, well, I don't want
Well.
to piss Judy off.
I say 25 milligrams or less.
25 milligrams?
So-
That's like 2 sips of coffee. Are you serious?
No, you can have a tall Starbucks or Pete's. That's
Okay.
about 25 milligrams. You just don't want to go over that. One, it affects the way your blood sugar is handled, number
Right.
one. Number two, the caffeine isn't very helpful for the body in general.
See, I think it puts people in a good mood and helps with their metabolism.
It does do that.
Yeah.
But it also makes them shaky, overhungry, overeat,
Okay.
nervous,
well, you're going to
panic
have pros
attacks.
and cons.
You have pros and cons, yes.
So you can have a cup and you won't get mad at my patients.
Yeah, a cup is good, and I tell
Okay,
them all
I'm going
a
to
cup.
send everyone this video after this.
Yes, go ahead, send this video.
I'm going to send this to everybody.
But on that note, we need to talk about green tea. I'm not
Okay,
sure if
tell
you're
me
just
about
talking
green
about
tea.
green tea with patients. A lot of people
Okay.
are doing that because they think all these great antioxidants.
Right.
The problem with green tea is it's extremely cold to your body, whether you drink it hot or cold.
Really?
And one of the greatest studies came out showing that it actually impacts in great volume the lining of the uterus.
Interesting. I had no idea.
So we stay away from all green teas
No green
as
tea.
well. You
Okay.
can have black teas, which have
Okay.
caffeine, so you have to monitor that 25 milligrams.
Okay, so I'll be sure to just tell patients to go easy on the green tea, and if
No
not,
green
just
tea.
like cut it out all the way. So a
Correct.
little coffee, a tiny bit of alcohol, no green tea, no ice cream. So what can I eat or drink? What do you tell patients?
So
Because
we
I'm sure you tell them to
patients
eat exactly what to eat.
So some women are trying to diet while we're trying to make a baby, and the decision is we're either making a baby or we're on a diet. So we need to eat at least 1,500 calories a day, nothing below that, or we don't produce the great hormones that we need. The other thing that we push is good sources of fats so that the hormone chain is actually working effectively.
So a good source would be
So-
similar to like Mediterranean diet, probably.
Mediterranean diet is very similar. We're also kind of like a paleo diet a little
Yeah.
bit. So we push the salmons and the avocados and the nuts, for instance, for the good fats. We also ask you to eat about 50 to 60 grams of protein.
Okay.
We ask you to eat good grains. So the grains that we typically recommend are going to be things like millet, quinoa, things that are gluten-free but also have protein content to them.
What's millet?
Millet is a small little grain that tastes like almonds.
Okay.
So a lot of women will eat that. It looks like couscous kind
A
of.
lot of. I've never even heard of it.
Well, you're going out tonight. We're going to go have some millet.
Millet.
It's a lot in the Italian diet.
Yum.
So you're not Italian, I am. We eat that.
Okay. No.
But the diet would consist mostly of fruits and vegetables, a lot of the dark green leafy vegetables, so that we can build up the body correctly.
Okay.
A lot of good proteins, a lot of good grains, small amounts of dairy. We're not very big fans of dairy in Chinese medicine, especially if they're not organic.
Okay.
So we do allow 1 item of dairy a day, meaning 1 piece of cheese, 1 yogurt.
Got it. And can
One glass of
acupuncture help PCOS patients?
Yes, acupuncture can help PCOS. Number one thing that we do is look at the diet. We start implementing the diet where you're eating every 2 to 3 hours so that we can maintain the insulin levels. We also use points in the abdomen to help with ovulation if you're not currently ovulating as a PCOS patient.
And that stuff works. I'm telling you. I mean, I have had patients where I'm just so scared to transition them to gonadotropins only for their stimulation because they haven't responded to Femara or Clomid.
And
then acupuncture works. It's like,
Yeah.
voila.
And
You
a lot
wanna
of
be
it
like-
is just listening to the diet, changing the way we're doing things. We do ask you to exercise with moderation too, and try to lose a little bit of weight if you're overweight, and that helps the estrogen come out of the fat cells. When the estrogen comes out of the fat cells, it's more usable to the body hormonally, and we tend to see more pregnancies occur.
That sounds like a win-win all the way around. So what's the regimen around transfer day? So transfer day, you want to do pre and post transfer acupuncture. What's the best sort of protocol, and what's your protocol?
So our protocol is based on your history too. So there was a study done, in 1998. It's a little bit outdated on how they did it and what points they used. So we use that as a basis, but we also modify it specifically to you and your history. So on that day, we usually have you come about 45 minutes before your transfer time. That way you have plenty of time to get comfortable, stop being so nervous. We'll administer your Valium for you if you've been given the Valium. We'll check the bottle, make sure it's really diazepam or Valium, whatever you gave
Not
us.
doxycycline.
Not doxycycline, which I have seen. And we make sure that everybody's on time. And if they're not on time, we go ahead and hold back on the Valium and just keep you laying down in our office until the doctor is actually ready for you.
Oh, that's
so
nice
that
of
you don't get nervous.
Yeah.
But the points that are used in the transfer are things to encourage blood flow to the uterus. They also relax the cervix so that it's a little bit easier when we're using the instrumentation to go in. So it aids the implantation. And when you come back afterwards, usually you're back about 30, 45 minutes, depending on how long it takes the doctor. Speedy Gonzalez over here, she does really quick, so I know her patients will be back very quick. When you come back, then the treatment is also very
How did
different.
you know that's my nickname?
Oh, you are Speedy Gonzalez because trust me, I know. When your patients come back about a half hour later.
Right.
So yeah.
I want them in your office doing their
Yeah.
thing, getting their uterine relaxation on.
Right. That's right. Got to relax that uterus. So it helps a lot of people. They feel really comfortable. They are more relaxed when they leave to go get their embryos. I think that actually helps the more that we're nervous. And the reason we use the Valium is to stop any uterine contraction. So the acupuncture is also there as an assistance.
And then I've had patients say, Judy checked my pulse, like, because you also see patients after the transfer and they say, she thinks that I might be pregnant. How does that work? What's the mechanism there?
So it depends on the amount of days after the transfer we can pick up the pregnancy pulse in Chinese medicine. The unfortunate part is it sits on the same channel as if you ate food. So you have to make sure you're not having a food baby, but you're having a baby. So we always ask you how
well
soon
fed. Don't go in fasting
you
for
have
that
eaten
pulse.
so that we know if it's food related or baby.
Okay.
But usually about 6 to 7 days, depending on how many treatments I've actually worked with you, I can tell immediately if you are in fact pregnant, especially if you've conceived twins.
Okay. And can you tell if it's a boy or girl?
Yes, we can tell if it's a
How?
boy or a girl.
Really? Come on.
After
You're right, like
many years.
50% of the time.
Well, yeah, right, 50% of the time. More than that, actually. We average in the 80 percentile range for success on gender. Unless you've already tested it for us, then we're very accurate, 100%. But yeah, the pulse will change bilaterally when the woman is about 9 to 10 weeks pregnant. We can tell what the gender should be.
How?
On one side of the body is stronger than the other, and if it's on one side, it indicates a boy, and the other side, it's a girl. Wow. So we can tell based on that.
Okay. And then why do you get so mad at my patients when they walk in with heels on? I see the patients, they're like, I have a secret pair of shoes that I take off and put back on before I go in to see Judy so she doesn't get mad at me for wearing heels into her office. So what is the story
It's not so much Judy,
behind
it's
heels?
George that does not like that. It's very traditional.
Okay.
What they think is that the higher the high heel, it tilts the pelvis, and when it tilts the pelvis, it changes the blood flow into the uterus and to the ovaries, and it shunts it off, basically. And when we do that, we have less likelihood of good nutrition to the ovaries and the uterus, and then therefore our outcome might not be what we're looking for. Especially when pregnant, we do not want to see a lot of high heels or overly high heels.
Yeah.
If you're wearing a 2-inch heel, it's not really an issue. It's the spiked larger 3-4 inch heels that are the issue here.
Got it. Yeah. And then in pregnancy acupuncture, I tell my patients who do acupuncture actually have less nausea, less vomiting. Their first trimester is actually a lot smoother for them. And I think that's definitely well proven in the literature as far as
the literature will show it can stop bleeding, especially if it's like a subchorionic hematoma, which is just a small bleed
from pregnancy
that has nothing to do with your baby, but yet you're seeing blood, so you're a little bit nervous. The acupuncture, in fact, can stop that. We use something called Moxibustion that we show you what to do. You do it at home, and it actually aids and stops any kind of bleeding as well.
Is that where people like burn pieces of their hair off?
Yes. If they don't do it right, you may burn your hair.
I've seen bald spots, Judy.
And you know what? When you're pregnant, you don't care that you have a bald spot. If you've been trying for 10 years and you have a baby, you don't really care that it's bald there.
I know.
But we do show you how to do that. It's got great research on that. We have you do that Moxa at least through the first trimester to prevent miscarriage. It also increases blood flow. So sometimes when we scan you, or not we, when she would scan you, your baby is actually a little bit ahead of target. And that's due to that diet that we give you, the acupuncture itself, and this Moxa.
And then do the babies come out really loving salmon and millet?
Usually they don't. No. Most babies that have had acupuncture through the entire course of the pregnancy are actually very calm babies.
Okay, and they're smarter.
They have shown a little bit of increase in brain activity, but mostly they show that they are not as colicky, and they actually have good birth weight.
I wish I knew that back
in the day.
Back in the day.
Me too.
Other questions are, so what we have planned today is that Judy's going to give me a uterine massage in front of everybody, live, right now. Judy?
Sure we are. No.
What's the story with the uterine massage and the Mayan massage? Like, what's the difference? How does that work? Are you really manipulating patients' uteruses? I mean, we're in medical school. I know you know what you're talking about.
We're not actually touching the uterus through the vaginal canal. We're not going this way in there. It's always done externally.
Okay.
It's done basically from the breastbone to the pubic bone. It's about 45 minutes of work. It's very finite movement. The Mayan massage is just another name for it. We call it by its Chinese name, which is Qi Nitsan. It's exactly the same method. The purpose of that is going to be to open up the fascia or the abdominal wall and get blood flow to move down into the ovary and the uterus. What they can feel is any kind of nodulations or possible cysts, some fibroids. If they're large, we can feel those externally.
Right.
And so they're using this method to break down those things, encourage the blood flow. It also helps get rid of stress. Most women store all of their emotional baggage through the abdomen. So a lot of people have a lot of abdominal releases for emotions, especially if there's been any trauma sexually or any kind of miscarriages.
Right.
So this helps us be able to move forward into another cycle and be well grounded for it.
Okay. So do you think that the abdominal massage helps also with stress and relaxation too? I mean, do people leave the Mayan massage feeling more relaxed?
Yes, they do. They once you get over the idea that somebody's actually touching your abdomen, most of us don't want massage there. We like it on our back or our neck.
Right.
Once they get used to that idea, everything feels really warm. It can change your libido very quickly. It increases the cervical mucus, so they feel more grounded in general.
Whoa. You said libido.
Yes, it will change your libido.
Partners how to do the Mayan massage so they can get it on at home? Does that help at all with that?
You can teach it. We do teach it to some patients. It's also on things on YouTube, so you definitely can look on there to figure out how to do that. What I find with most IVF, IUI patients, anybody in the reproductive field, there's so much stress and so much anxiety associated with when do we have to have sex? Oh my God, hurry home, today's the day. And there's so much pressure that these things are actually techniques that will help relax them so that it now becomes enjoyable. You're making love to your husband versus it's my job today.
Yeah, I mean, if you took my ice cream away.
Yeah, it took your ice cream away and your coffee. What are you going to have? And no alcohol. And no alcohol, then there's no fun anymore. Yes.
The abdominal massage will
The abdominal massage is worth trying. It is a little weird at first, and then most people actually prefer it.
Okay, great. So Judy, it's been so fun having you on the show tonight. You're just such a breath of fresh air. And speaking of breaths, before we end the show, I just want to ask you, what kind of suggestions do you have for your patients? Because we both see a lot of the same patients, and they've gone through so much trauma. What kind of recommendations do you make to them about how to deal with stress? I mean, we all have stress. So the real strategy is how to cope with it.
How to cope with it. So we use a lot of relaxing music inside the clinic. I also refer them to some stress and meditation things. There's a lot of meditations that are done for IVF associated to that. You can purchase those. A lot of times we're playing them in the clinic. We also teach something called bottle breathing because most women we breathe very shallow from the chest.
Bottle breathing?
Bottle breathing.
Bottle breathing. Can you do it with me? Can you teach us?
So basically you make sure that you're sitting upright so that you're relaxing the pelvis, and you breathe in through the nose. And when you breathe in through the nose, you want to feel the breath come all the way down into the lower part of your abdomen. And then when you go ahead to exhale, you exhale from the bottom and then all the way up through the top, basically. So you're exhaling from the bottom of the bottle. And then when you do that, it relaxes the whole entire nervous system, resets the sympathetic nervous system so that you are, in fact, more relaxed in general.
Okay, so
we
you're
teach
inhaling from the top of the bottle down.
And
And
so you're
then
filling the bottle up,
exhaling.
and then you're draining it from the bottom to the top. And when you do that, you'll feel a release of all your
Oh yeah,
muscles.
no, it works. It takes a couple breaths
have
to
to do it a
kind
few
of
times,
imagine it.
and
But
the
I
very-
like it, bottle breaths.
Bottle breaths.
I'm going to use that, bottle breaths.
Then the other thing I teach is body scan meditation. I think that women that have a lot of things going on, we have work stress, commute stress, etc. I teach what's called body scan meditation, where you focus on a body part. You breathe through that body part, you move to the next part. When you do that, it's keeping your focus on that foot or on that leg instead of on the laundry that needs to be done or something else. So it gives you 30 full minutes of just relaxing, and it keeps you focused. Your mind doesn't tend to wander versus just trying to do this kind of meditation like this. It doesn't work when you're a very busy person.
Right. No.
So these body scan meditations, you can purchase them, you can YouTube them.
And you can do them while you're driving.
You can
that's
do
what
them
I
when
do.
you're driving. That's
Yeah.
right. I always tell people, why don't you sit upright? You know, for the next 5 stoplights, you do the bottle breathing, and then you just forget about it again. And then you just go on to the next, whatever you want to do, or you wear a rubber band, you remember at 12 o'clock every day, you do this breathing.
Right.
And
Oh,
it
that's
just helps
beautiful.
relax you, and the more relaxed you are, the easier it is to conceive.
Yeah, so we learned a lot about you today. We learned that, number one, you went to medical school.
Yes.
And I think there's some fertility stuff that we talked about before we started the show that a lot of people would be surprised about. Not surprised in a really good way. So tell us.
So my original journey into why I came into a more reproductive part of the medicine versus gynecology is that I was asked to be a donor. So I was an egg donor when I was 23 years of age, and we produced a very beautiful son for this woman that way. And then later on, I was asked to be a gestational carrier for another friend, and we then produced another beautiful baby boy. So
that's
technically,
wonderful.
I've had some great experience with that. I love being in that journey. It's just the best gift to give someone a child.
It absolutely is.
Yeah.
Well, you're just such a blessing to so many of my patients, and thank you for
well,
all
thank
your
you.
work, 16 years of it and more.
Yes,
We'll
and
be
more to
doing
come.
the same thing for years to come, and won't
right.
stop doing what we do because we absolutely adore our patients and we love helping them.
That's right.
So thank you everyone for joining the show tonight. You can find Judy at nurtureacupuncture.com. What cities are you in, Judy?
We are in San Ramon and San Francisco, San Jose, Orinda, and soon to be Foster City.
That's very exciting. That's awesome. Well, thank you for everything.
Yeah, thank you.
Thanks,
It was a
Judy.
pleasure.
Have a great night, everybody.
Bye-bye.
Hi, everyone.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.